Since 2009, the Boko Haram crisis has started as an insurgency but quickly snowballed into full-blown terrorism, alongside military operations being conducted by the Nigerian troops, have had a devastating impact on the northeast region of the country. The anti-terror campaign, which has lasted for more than 10 years, continues to destabilize local populations, draining security forces, reducing state finances, increasing food insecurity across the country, and escalating the spread of COVID-19. For a comprehensive outlook on this topic, COVID-19 and conflict dynamics in the northeast of Nigeria, we're now being joined by Dr. Ukiwo Ukoha, Technical Lead Managing Conflicts in Nigeria program, which is being funded by the European Union and implemented by the British Council. It's a pleasure having you. Welcome to the program, sir. Let's start this way. There is no how that a pandemic would not, exacerbate the prevailing conditions of insecurity. Pretty much like it was evident in the First World War. In the thick of the First World War, we had the first, global, one of the first, the second or third, because we had the bubonic plague then. So we had another pandemic in the thick of the First World War. And it did affect the war. A lot of people lost their lives to that too. And now we're having, insurgency activities in the Northeast, that we're having another pandemic at this point in time. And the war is not abating. How do we make sense of these two conflicting situations?
Thank you. Good morning, and thanks for having me.
Good morning.
I think the key point is to begin to understand the ways in which the pandemic itself would impinge on the existing dynamics in the area, looking at the drivers as well as looking at the counterinsurgency operations. And what we've done is to get researchers to look at some of those dynamics, how it might change. And we see that indeed that there are interesting implications for both the pandemic and the response of different actors, the state and non-state actors, to the pandemic. So for instance, we see that the lockdown and the poor movements, inability of people to move and to go out to have their livelihoods, have key implications for drivers of violence such as unemployment, inequality, and poverty. And because of that, increasing and rising alienation of the people to the state and state agencies. And, this is, evidenced by the poor level of trust that people have in terms of really messaging around the reality of the pandemic itself. So one of the key, drivers of the insurgency in the area had always been the lack of trust of people to public institutions, and the pandemic appeared to have exacerbated that. So that is a point to note. Another driver of violence in the region has been, poor access to dividends of governance, basic education, health facilities, and income-generating activities. Again, the pandemic has exacerbated that, and the closure of socio-economic activities have had serious effect on people in the area, and this also means that one of the drivers of the pandemic of the conflict is being exacerbated. So we also see that even in terms of relations, gender relations, relationship between men and women, relationship between young people and older people, again, is being further undermined by the trends we see in the pandemic. There have been reports of increased levels of sexual and gender-based violence, mainly linked to the fact that tensions in already unstable homes, are magnified, partly because people are not going out to earn their living. Some people have lost their jobs, and expectations around masculinities, what men are supposed to do in the home are no longer being met. And again, the tension between such men who have lost their jobs being able to keep their families together. So this has led to a spike in terms of incidences of gender-based violence. And again, reducing trust in at that little basic social unit, the family. Again, in terms of ideologies and religious mobilizations, we've seen that the pandemic has led to the closure and stoppage of worship both in the mosques and in the churches. And this has had key implications because one of the avenues to disseminate peace and tolerance, even disseminate messages around the pandemic itself and how members of the public are supposed to behave, has also been affected by the closure of churches and mosques. And again, the fact that it would seem the religious authorities did, as as would be expected, cooperate with the state institutions. The government has also raised some of the suspicions that people in some of these regions have in terms of the relationship between the state and religious authorities, the extent to which religious authorities occupy an autonomous space and can act as legitimate voices of the people. So that is a key factor. Finally, one other dynamic that has been exacerbated by the pandemic is the feeling of social exclusion and inequalities, and this played out in terms of the distribution of the pandemic palliatives, in terms of who assessed it. So we see that those elements in society that already felt aggrieved, persons living with disabilities, women, young persons, or people not belonging to dominant parties, appeared and feel aggrieved that they were not included or favored in the distribution of palliatives. So again, that sense of grievance have been heightened and would likely be a factor that may be mobilized by non-state armed groups in terms of mobilizing members to their groups. In terms of the counter-insurgency operations, okay.
No, please go ahead. Go ahead, Dr. Ukoha.
Okay. In terms of the counter-insurgency operations, we also know that the counter-insurgency operations largely would depend on the collaboration of communities. And in that situation of distrust and increasing concern, the ways in which civil-military relations are going to be affected is something that we are looking at, because when people are aggrieved and are having challenges in terms of earning their daily livelihoods, the extent to which they can share information with authorities would clearly be affected. Also, even supplies to the military, given and other actors that are involved in counter-insurgency operations, we are somewhat affected by the insurgency from the findings that we see. Even though there are also indications that also supplies to the insurgents themselves may also have been affected by the lockdown itself. And this has reflected in a way in desperate attempts by the insurgent groups and their members to raid communities and take whatever they can have. So part of the spike, noticeable increase in attacks on some communities might be linked to the challenge of the insurgents themselves being able to get their normal channels for food and fuel and other things they need for their sustenance. So it would be good to for different actors to really think through some of these implications and what might be done to see that we don't have a sustained trend in those directions that would further exacerbate the tensions and lead to more escalation of violence in the region.
Well, Dr. Ukoha, let's open it up a little bit and talk about conflict dynamics. Conflict is a fact of human reality. And here in Nigeria, from the 19th century wars in Yoruba land to 1948, when we started having issues in southern Kaduna region, in Zango Kataf, specifically over taxation. Nigeria has been faced with the challenge of managing conflicts for almost a century. But the question is, what do we do to build peace, to resolve conflicts? What mechanisms do we still need to adopt? Where did Nigeria miss it? Vertical integration, horizontal integration, balancing techniques. I think we should focus more on what should be the solution going forward, and where did we miss it in the past that we need to address.
Addressing, conflict in Nigeria it's something that will need at different levels some efforts in terms of enhancing understanding among different groups, not only in terms of ethnicity, that is ethnic groups and religion, but also in terms of class and the sense in which people feel included or excluded in society. So that dialogue needs to go on, and we need to develop institutions that can deliver a set of, basic tolerance and acceptance that the Nigerian project, the Nigerian state, is for all of us. At the moment, it doesn't seem so, and this has manifested itself in the ways in which different actors have mobilized against established institutions which they consider not to be in their favor. So something of that sort needs to be done at a very, very structural level to get actors, different groups to believe that the Nigerian state as presently constituted is for everyone, and that every citizen has equal rights to what especially comes from the state, which apparently at the current, clearly, if we see the debates going on around restructuring, around issues around revenue allocation, issues around employment generation, continues to be a key challenge in terms of our nation building process. The other aspect of a long-term peace building approach would be to develop institutions that are supposed to manage conflict and to respond to conflict. Currently, that remains an area of challenge. The institutions that manage conflict do not appear to be clearly coordinated. They do not seem also to be inclusive in the sense that there are no channels to bring in civil society voices in security decision making and security implementation. And when we mean civil society, we are talking about community associations, women groups, and community leadership groups, the extent to which they are involved in early warning and early response mechanisms that exist within the state. That needs to be strengthened. And, for people that have worked in this area, it has been clear that some progress is made in terms of early warning. So communities, when they notice movements or notice emerging trends that are likely to drive violence, draw attention of authorities to such dynamics. But the key challenge has been the response mechanism. And oftentimes, different actors at different levels draw attention to the current structure of, for instance, centralization of security forces and limited decentralization of authority to local authorities in terms of security response. And so that inhibits immediate response to early warning. So that is an area that needs to be strengthened so that people do not get exasperated by the fact that they keep on sharing intelligence of movement of arms or movement of persons that are likely to get involved in violent group actions. And there is no response, and what will happen is that, is when the violence incidents already taken place, that state officials would turn to the scene to deliver condolence messages and palliative. So the early warning systems need to be strengthened across the board from the local, provincial, state, regional and national level, and as we speak also regional and continental level. So that needs to be done, and done urgently. And finally, the issue of opportunity for young persons, opportunity for women, not just in the political space but also in the economic sphere, need to be addressed, through a socio-economic, reform program that really puts opportunity to excluded groups at the center stage. So, as we speak, the unemployment situation and the poverty situation is getting worse, and we know for a fact that in most acts of violent group mobilization, that those that are vectors of violence, that is those that are deployed to get involved in violence, often will mobilize those actors that have been marginalized in society, have no access and have no options, in terms of their livelihoods into violence. And so, the job, generating jobs for people, and also ensuring that the state itself is able to give, to mediate a process where people have a living wage, and people's wages are being paid as promptly, would be very, very critical. As we know currently, many state governments are still struggling to pay wages in the public sector. And even in the context of the current pandemic, the fact that the private sector has mostly been affected, the inability of the states, particularly state and local councils, to be able to promptly pay salaries, to workers in the public sector is very, very alarming, and needs to be, to be addressed. It is good that the federal government is coming up with a kind of, post-COVID plan. It will be interesting to see how concerted effort will be made to see that that state governments and local councils also have their own plans and are carried along, and that we see that federal-led efforts, also yield dividends at the local level, so that there is really a clear dividend for people, most of Nigerians who really live at these levels.
All right. Dr. Ukoha, you have highlighted challenges, and to be specific, you did mention response mechanism as a key challenge. But do you think that this could be as a result of the lack of proper assessment and understanding of the conflict and its triggers by leadership? How would you assess the management of the conflict by governments across board, from the federal to the states to the local government levels?
This is a very, very important question, and we have over the years at different levels been involved in knowledge production and dissemination in terms of what the drivers of violence are. And it would seem that over the years we've accumulated quite a handful of knowledge in terms of what these drivers are. And so it would be really, really difficult to say that the challenge is a lack of understanding of what the drivers are. The key issue is, are we able to summon the courage and to move on to use the findings of what we've, through not only conventional research, but also what even government and panels, commissions of inquiry come out with in terms of what the drivers of specific incidences of violence has been, So again, we need to look at that. So it's not the absence of knowledge. I am wary about using the term, overflog term that we often use in the Nigerian context of political will. The key point is that as much as we, are, traumatized by the incidences of violence in the country and elsewhere, the clear fact that we know is that there are incentives to violence and, to act and not to act. And it would seem in several cases, incentives of different actors, whether in the state or in the non-state, not to act and address issues around violence seems to exist. And this often hinders effective response. Apart from the capacity issue, the capacity, for instance, we have conflict management institutions that the traditional leadership structures at the communities have been incapacitated over the years, so that even though they know things that are happening in their communities and they can share information, but they are in many instances helpless in terms of what they can do. And different actors know that it is important to empower those institutions at those levels, but we don't seem to have summoned and mobilized the courage and have the right incentives to do that. So it is not the absence of information, even though we think we need to continue to drill down and look at the ways in which these drivers, whether they be structural drivers, facilitating drivers, in terms of drivers that make violent group mobilization to be strongly possible. Like we now know, the sheer level of arms proliferation in the country, the sheer use of drugs by actors, and the ways in which they have been disseminated across the board. These are facilitating factors that we seem to be losing control on over. We need to address them. And obviously, we also need to address trigger factors such as hate speech and insensitive communication, and certain things. For instance, changes that just throw people into the job market without any signals, like the COVID-19 pandemic. So these things are there. Some of them are unique to particular context, but the futures are fairly shared across the board nationally and as well as regionally. So, and there are things that, like we said, we need to have, some kind of shared understanding of this and a shared agreement of the need to address them across the board, both from state actors at different levels as well as civil society actors.
Right. You've said a lot, and you've been able to enumerate the factors, and we catch it, we get it. But a lot of people say, in all of these factors, I mean, how can we make life easier for a lot of people, going through all of these dynamics, the war, COVID-19 and the likes? How can we make it easier on them, even if the war is not abating anytime soon?
Yeah, so different actors recognizing their mandates, need to, and this is what, through the program we advise and support, do, is in terms of building the capacity, recognizing the different agencies, political and social agencies that exist, and trying to strengthen their capacity to do what is their mandate to do and to do it better. For the security agencies, it's about building capacity, both in terms of training, as well as in terms of motivation and equipping. So that is very, very critical. At the civil society level, we also need to build that capacity and generate coordination. So, for instance, creating forums and platforms where periodically state institutions responsible for management of conflict and prevention of violence come together to do joint risk assessments, and through these risk assessments are able to provide, identify what the risk factors are, and collectively in a coordinated manner, respond to that. This would help to build trust. It will help to build collaboration. It will help to address some of the factors that are responsible for alienating public from security service providers, when security service providers are seen as working hand in hand with members in the community, and there's that trust and joined up effort to address violence at that community level. Finally, there should also, in terms of these workings, be some level of accountability. So when people cry and say they reported a suspected incident, 2 weeks before it happened, to security services or state actors, the government, and we find out that that information was not used to prevent that incidence of violence from actually occurring. We should have some level of accountability mechanisms to call such persons to book to see whether they are indeed incapacitated to act, or that they were privy to the incidents of violence that that taken place. So so that kind of accountability mechanism needs to come in place, and we have existing institutions like the National Human Rights Commissions, or even the Public Complaints Commission, that existing institutions that can address this.
Thank you very much, Dr. Ukoha, for joining us this morning on the Morning Show. Thank you very much indeed.
Yeah.